There we go. The recording's going. Just want to make sure. Can somebody pop in the chat? Do you let me see if I can share the slides. So you should see the opening slide now. Perfect. So my name is Jim. Full disclosure, I come from the performing side. I was on the performing side for about 35 years. I landed here during the pandemic. I'm also a trustee on the Screen Actors Guild Health and Pension Plan. If you have specific questions about SAG, health and pension, let me know at the end. But this is really a national webinar for dramatists. There are some slides in here, since the Dramatist Guild is located in New York. There are some slides in here that are sort of New York centric. So I'll be talking about some New York centric items and eligibilities, but generally this is geared for a national audience. So this should apply to you no matter where you live in the country. So let's get started. Who we are: we're the Entertainment Community Fund. For almost 100 years, we were known as the Actors Fund. We changed our name a couple of years ago because we're not only for actors, the mandate covers everyone in the entertainment industry. So writers, dramatists, musicians, crew people, agents, ushers. If you're in the entertainment industry, we are here to support your life in the arts. We provide a whole suite of social services. So we do things like financial assistance. We have a housing department for affordable housing. We run affordable housing projects in New York and California. We have a career center if you're looking to start a business or change careers or find a side hustle. We have social services, so for short-term counseling, or again, for financial assistance, emergency financial assistance. We have support for seniors. We have support for kids. We run the Actors Fund Nursing Home in Englewood, New Jersey. We do a lot of stuff. So if you need us, we're here. You may not need us all through your career, but there's always a time in your career where you may be in need of our services. Please feel free to reach out. Our team is the health services team. So we work in the health insurance area. We do a webinar similar to this every week about finding affordable coverage for those under 65, affordable coverage really on the Affordable Care Act marketplace. We also do Medicare counseling, and we do a Welcome to Medicare webinar every Monday as well. Most of our team does one-on-one counseling services for people who need health insurance help. So if you're applying for health insurance or need help with that, or aging into Medicare, or checking your Medicare coverage for next year, you can use us. You can set up a one-on-one appointment with one of our navigators. We also have a bunch of educational materials on our webpage. The webpage is listed at the bottom there, entertainmentcommunity.org/AHIRC. AHIRC stands for Artists Health Insurance Resource Center. That's our page, and everything lives there. And we do a fair amount of advocacy in the legislative area, fighting to make coverage more accessible and affordable for people in the arts. We work on the COBRA subsidy, which I'll talk about here in New York, and we're fighting the cuts that are coming from the federal government on Medicaid and the ACA. Not incredibly successfully at this point, but we're out there fighting the good fight anyway. So our agenda for today. The first thing I'm going to do is just get everybody on board with some health insurance vocabulary. So just a couple of pages, just a couple of slides about terminology, because I'm going to be using the terminology during the webinar, and I want you to be familiar with it. They're basic terms. You probably know a lot of them, but they trip some people up. So we'll go over some of that. Then we'll do a review of the Affordable Care Act, just rules and general sort of parameters for 2026. And I will go into the federal changes, the changes that came out of the health insurance law that passed in July, called the HR1, or the Big Beautiful Bill. We'll talk about how those changes are going to impact coverage now and moving forward. And then we'll talk about what your options are. So you probably showed up to the webinar today because you're either curious about insurance, you may be losing your insurance, worried about losing your insurance, you may not have insurance. We'll talk about what your options are right now, whether they're COBRA, purchasing directly from a carrier, or we'll spend the bulk of our time talking about the Affordable Care Act marketplace. At the end, we'll have some resources for people who remain uninsured, and we'll talk a little about the Friedman Health Center here at in New York, in Midtown. So just some basic vocabulary 101 for health insurance, right? The words on this page are related to a health insurance policy. So a premium. What's a premium? A premium is the amount you pay every month for the pleasure of having health insurance. That's all it is. You pay it to the insurance company. That's their fee. They give you insurance. A deductible. A deductible is the amount of money that you're responsible for medical services before the insurance plan starts paying for anything. So if your health insurance plan has a $1,000 deductible, excuse me, starting on January 1st, you're responsible for the first $1,000 of medical services. And after you meet that $1,000 deductible, the health plan will start paying its portion. A copay. A copay is a flat fee that you pay at the doctor's office or the pharmacy. So if your plan has a $20 copay, you're paying that at the office. Coinsurance is the one that I think throws most people. Coinsurance is expressed as a percentage, and it's the percentage of a medical bill that you would owe even after you meet your deductible. So if your coinsurance on your policy is 40% and you have a $1,000 deductible, you're responsible for paying that first $1,000 in medical services in the year. And then after that, the health insurance plan will pay 60% of the bill. You'll still be on the hook for 40%. Again, plans are structured differently, 70-30, 80-20, but it's the percentage you're responsible for even after you meet your deductible. Out-of-pocket maximum. All plans on and off the marketplace have what's called an out-of-pocket maximum. The maximum amount is set by the federal government. For 2025, I think it was $9,425. That's the most money you would spend on medical services in a year before the health plan has to start paying anything. Let me qualify that. Spend on a year in medical services that the insurance plan would cover. So it doesn't count things like, well, it doesn't count your premium. It also doesn't count things like over-the-counter medications, or if you're buying supplements or something like that. It's not going to cover that. Or cosmetic things like hair growth products or things like that. It's not going to cover that. But out-of-pocket medical spend on stuff the insurance company would normally cover, once you reach that max, it's like a stop-loss insurance. After that cap, the insurance company is obligated to pay 100% of the bill. Some terms related to the marketplace. There's an income scale that's created by the federal government called the Federal Poverty Level Scale. The federal government, in its wisdom, creates a level at which they find people would be impoverished. For 2025, an individual would be considered at 100% of the federal poverty level if they made at or below $15,650. A couple would be considered impoverished if they made $21,250 or less. And the reason this scale is important is that eligibility for different sorts of government benefits are expressed as a percentage of the federal poverty level. So the numbers on the screen are 100% of the federal poverty level. 200% of the federal poverty level for an individual would be $32,000 or so. Right, it's 15,650 times 2. My math is terrible. And then they look at benefits at 100%, you may be eligible for certain benefits, 200%, 300%, 400%, etc. Okay, and that'll come up a little later when we talk about the marketplace and the discounts available on the marketplace. When I say marketplace has 100 different names. People call it the Affordable Care Act, they call it healthcare.gov, they call it Obamacare. It's all the same thing. In your state, it may be called a specific thing, like New York State of Health is what it's called in New York. Covered California is what it's called in California. The federal government has a website for states who never set up a state marketplace. The federal government website is healthcare.gov. The advanced premium tax credit is a fancy name for a discount. This is the discount you can get based on your income, the discount you would get off the cost of your monthly health plan premium. And we're going to talk about this a little in more detail when we get to the marketplace slides. A couple of other terms, in-network versus out-of-network. Most people know this, right? When a doctor accepts a certain insurance plan, they're said to be in-network with that insurance plan. This becomes important when you determine the kind of plan you're getting, right? And you'll see a couple of the kinds of plans listed here: HMO, EPO, PPO. These are different plan designs, the way the plans are designed. On the marketplace, most all plans are HMO or EPO plans. When you're in an employer plan, you're working for a company, or in a union plan, those plans are most often PPO plans. So what are these? An HMO stands for Health Maintenance Organization. Once you choose an insurance company with an HMO, you have to use doctors in that insurance company's network in order to get the services covered, right? If you go out of network, you're paying out of pocket. Also, with an HMO, you have to have a dedicated primary care physician who's in the network. And if you need to see a specialist, you need to get a referral from that PCP, from that primary care physician, if you need or want to see a specialist. An EPO is exactly like an HMO, except it gives you one extra perk. And the extra perk is you don't need to get that referral from the primary care physician to see one of their specialists. You still have to stay in network, but you can go directly to the specialist without seeing your PCP first. And a PPO gives you a great deal of flexibility. These are the plans that we kind of wish were on the marketplace because they can be national in scope. You can see any doctor you want. You save money if you stay in the network with a PPO, but you can see out-of-network doctors. There are PPO plans on certain marketplaces. California is one of them. Except in my opinion, they're really PPO in name only, because the deductibles on the PPOs in California are so high, in the $10,000 to $15,000 range, that you wind up paying out of pocket for almost every doctor you see that's out of network. So unless you're in a sort of catastrophic event, the PPO thing really doesn't kick in. So that's our vocabulary lesson for today. Just general rules for the marketplace, right? If you're going onto the Affordable Care Act marketplace, you cannot be refused coverage. They cannot consider pre-existing conditions. These are all rules that came in with the Affordable Care Act in 2010. It's guaranteed issue insurance. There's no penalty for being uninsured in certain states like New York, but some states retain the ability to levy a tax penalty if you remain uninsured for more than, I think, 3 months in the year. And you see the list of states there. The ones that would apply here are probably New Jersey, California, maybe Washington, D.C., and Massachusetts. If you're in those states and you're uninsured for a certain amount of time, you will owe a penalty on your state tax return. All plans on the marketplace cover preventive services for free. So that means wellness visits, cancer screenings, the list is here, vaccines, etc. The difficulty with this is sometimes, you start off with a wellness visit or a cancer screening, and it turns into a diagnostic visit, right? You go in for the classic example is you go in for a colonoscopy, they find something, they remove it, and they say, hey, congratulations, now you just had a diagnostic visit and you're on the hook for the copay. But generally, preventive services are covered for free. There are mandated benefits under the Affordable Care Act. In other words, health plans that offer coverage on the Affordable Care Act have to cover these things, not the last two. Chiropractic, gym membership, I think, is sort of optional. But the first 10 or 12 services on here must be covered by the insurance plan. Doesn't mean they're covered for free, but they have to include coverage for all of this stuff. So mental health, physical therapy, maternity care, hospitalization, etc. Excuse me. Sorry, I have a little bit of a cold. So thanks for being patient. This is what a lot of people are interested in. I don't know how much how much you're paying attention to health news these days, but changes are coming at the federal level. In July of 2025, Congress passed a bill called H.R. 1, sometimes called the Big Beautiful Bill. This bill is going to eventually make insurance harder to get, harder to keep, and more expensive, right? If there's good news about the bill, it's that the more drastic changes to health insurance aren't really happening until later on, right? They front loaded a lot of the good stuff, tax cuts, etc., and they back loaded a lot of the bad stuff. So we're expecting things to get sort of worse as we move into the law and further on in time in the law. But for right now, except for one or two things, which I'll mention, right? For right now, most renewals will proceed as normal, right? If you're on Medicaid right now and renewing for the first of the year, or Medi-Cal, or you're on a program called the Essential Plan in New York, you should be able to renew without any sort of disruption for the coming year. Some headwinds that are present right now. First is with immigrant populations. So including visa holders, these are the people who are going to face the most challenges renewing. For instance, folks who were in the DACA population, the DACA recipients were dismissed from coverage in August. They're no longer eligible for tax credits or discounts off their monthly premium. They are still eligible for Medicaid, but not for discounts. Also, the tax credits that were expanded during the Biden administration are now being ended. Currently, this is what the government shutdown is about, actually, are being ended for 2026. That's the one that's sort of the most emergent right this second, is that folks who are over a certain income threshold will no longer be getting discounts off their monthly premiums. I think I might have this on the next slide. So just moving into 2026 and then a little bit later. That first bullet point is what I was just talking about. So expanded subsidy rates are expected to end on December 31st. There is a chance this will not happen. There is some talk at this point that there will be a deal in Congress to extend the expanded subsidy rates. But right now, what we're saying and the most accurate information we can deliver is if you're making more than 400% of the federal poverty level, 400% of the federal poverty level for an individual is $62,600. If you're making more than that, you're going to be paying full price for a health insurance plan. You're not going to be getting a discount based on your income. The other bad news about that is most insurance companies have raised their rates for 2026. So premiums are going up, discounts are going away, and so prices are expected to be quite a bit higher. There are cases where you run a marketplace application and they ask you to document your income. We expect documentation to become more stringent, a little harder to prove your income, especially in the freelance or sporadic work community like the arts. Also in 2026, not this year's open enrollment is the same. Next year, open enrollment is going to be significantly shorter. We're not sure exactly how short. I haven't seen dates. It's going to probably match what Medicare does. Medicare open enrollment is between October 15th and December 7th. So it's a short window. We're probably going to get about 6 to 8 weeks of open enrollment. The practical effect of this will be that people will miss the enrollment window and then be locked out of insurance for the rest of the year. Moving forward, 2027, 2028. This is the stuff that was sort of the most detrimental to lower income individuals. There will be work requirements on Medicaid for eligibility in Medicaid starting in 2027. States can apply for an extension to the work requirements to 2028. I know New York has already applied. We're not sure when the determinations will come. I don't know about the other states. I'm guessing California has, or California will, and probably New Jersey will as well. There's also going to be biannual certifications for Medicaid beginning in 2027. So what can you do in the face of this, right? The best thing you can do is pay attention to what's going on, right? Know when your coverage starts and ends. If you have union coverage, know when it's sunsetting. If you have marketplace coverage, know when you have to renew, whether it's in the middle of the year or at the end of the year, like now with either like a bronze, silver, gold plan, you have to renew by the end of December, or by the end of December. Rely on us for accurate information. We are putting out information. You can meet with one of our health insurance counselors one-on-one to figure out your options. And I listed some other resources here that are reliable health news resources, right? The Kaiser Family Foundation is terrific. They do a lot of good work on this, a lot of accurate work on what's happening there. In New York State of Health has a Stay Connected webpage, which is it's updated frequently. So they're giving a lot of information, especially about New York options, but they are dealing with some of the federal changes as well. And then your state marketplace website or healthcare.gov should have information. New Jersey had a page called, it was called Frequent Updates, but it hadn't been updated the last time I looked. So I don't know if they're going to be publishing anything on that page, but you can take a look. But that's where to go, is the marketplace websites or the Kaiser Family Foundation. So what are your options right now if you're looking for insurance? You might be eligible for COBRA if you had insurance through your family or a job or a union. You can call an insurance company. I don't recommend that. I'll tell you why in a second. Or you can get coverage on the marketplace, right? Including enrolling in programs like Medicaid, Medi-Cal, the Essential Plan, or what's called the Basic Health Plan in Minnesota and Oregon. So this is the way this works. If you've had insurance, right, you had union or employer insurance and it ends, there's a law called COBRA. COBRA lets you keep your employer or union coverage, the same exact coverage you have right now, for 18 months, sometimes even longer, after you lose it. You have the right to extend your insurance for 18 months. You have 60 days to opt into COBRA, right? So when your coverage ends, you have 60 days to pull the trigger and pay your premium and opt into COBRA. And you have 45 days from the date you opt in to pay your premium, right? You do have to back pay the premium to the day you lost your coverage. So if you're opting into COBRA, if your coverage ended October 31st, and you wait till December 1st to sign up, you're going to have to back pay the month of November. You have to back pay to when you lost your coverage. The problem with COBRA is it's often very, very, very expensive. Most people do not opt into COBRA because of the spike in price. As an example, I know that Actors Equity Association, their regular active coverage is $300 per quarter, so figure $100 a month. Their COBRA rate is, I think, $1,140 a month for an individual. So if you have 3 people in your family, it's $1,140 times 3. Screen Actors Guild just announced their COBRA rates for 2026, and they are in the $1,200 a month range. So it's a pretty big hit. If you're in New York, if you live in New York State has a COBRA subsidy for people who work in the entertainment industry. This can be a really strong program if you're eligible for it. And if you are and you're losing your coverage, I would encourage you to apply. There's an eligibility test. It's here on the slide, right? You have to live in New York. You have to be a New York resident. You have to be losing your insurance from an entertainment industry union health plan, right? DGA, WGA, Actors Equity, Screen Actors Guild. You have to meet a monthly income test, and we're going to go over that in a second. You can't have any other coverage. So you can't have any other employer coverage or Medicare. And if you're eligible, you can keep the subsidy for up to 12 months. Remember, COBRA lasts 18 months. This subsidy would last 12 months. The hard part of the test is the income eligibility. So you see below, right, on the left side, there's, you see the size of the family, 1, 2, 3, and 4. And your monthly income would have to be below those figures, and you would get a 75% discount in the COBRA rate. So it's a pretty big discount. An individual, if you're below $5,217, you'd get a 75% discount in the COBRA rate. So the good news is you get to keep the same exact coverage you had. The bad news on this is even at 75%, this can be a pretty hefty hit. But if you're looking to keep the same coverage, it may be a way to go. We have the application at our website. You can also go to the Department of Finance in New York, who manages the plan. They have the application there. Or you can write to us and we'll be able to send you information. You can, if you're uninsured or looking for insurance, you can call an insurance company and ask them for a plan. The problem with this is you're not going to get the same sort of price or choice of plans as you would on the marketplace, right? So you're not going to get any discounts based on your income. They're just going to sell you a policy off the rack. And as insurance gets harder to get and more expensive, Our fear is that people are going to go on to just go online and start looking for cheap insurance. And if you're going to do that, you're more likely to run into these unsavory sellers out there who are peddling things that are purport to be insurance, but are really not insurance, right? Also, there's agents and brokers out there who will sell you policies. Agents and brokers aren't bad people, but they do have an incentive to sell certain companies because they work on commission, right? Here at the Entertainment Community Fund or in other places, there are state certified navigators and assisters, and they're certified to give you accurate, objective advice. So they let you make the choice. You can find local help in your state. There's assisters and navigators in every state. We're certified navigators here, but there are other ones too. They're all over the state. Be careful if you're shopping around. Remember that these things are sort of sold as short-term insurance plans. Sometimes they're called meta-share plans. These are not really insurance. Short-term plans, first of all, are illegal in a lot of states. The states are listed here. They're definitely illegal in New York and New Jersey and California. They might be cheaper, these plans that are out there, but they don't have to comply with the Affordable Care Act regulations. So what does that mean? They're not guaranteed issue. They can do a medical exam. They can consider pre-existing conditions. They can do all those things. We do see these red flag words pop up on the plans, right? They said, hey, we're not major medical coverage, or there's a membership fee. You're going to join for a membership fee, and then we're going to cover you in a certain way. But please, read what you're getting. I actually saw a policy a couple of weeks ago. Somebody came in with a policy on every page of the policy. At the bottom of the page, it said, this is not insurance. So if it says that, you're not buying health insurance, right? I don't know what you're buying, but you're not buying health insurance. And as these rules get relaxed on the federal level, more people get in there and start signing up for this stuff. Be careful if you really have a plan that you bought and you want to vet the summary of benefits, contact us and we'll go through the benefits with you. But it's a danger. So let's talk about where most people go, which is the marketplace, right? This is the homepage of the New York State of Health Marketplace in New York. I also put the New Jersey page here. I think I put a couple other ones. Here's Connecticut. Here's healthcare.gov. So make sure you're on a legitimate page when you get in here. And the way the marketplace works, because it works the same way, no matter where you are, right? You're going to fill out an application. You're going to submit the application. And the system is going to look at two specific things about you. The first thing it's going to look at is what they call the size of your household. They don't 100% mean that. What they really mean is the way you file taxes, right? It usually mirrors your tax filing status. And then it's going to look at your income, right? Right now, this is November 4th. So right now, we're still looking at income for 2025. We're still looking at this year. What happened this year? Once we get into, unless you're signing up for if you're looking for a plan right now that starts January 1st, or once we cross the 15th of November, then you're going to be looking forward at your 2026 income. You're going to be projecting your 2026 income, right? And then once it knows these two facts, it knows the size of your household, right? It knows your income. It's going to put them together. It's going to put you on a scale, the federal poverty level scale. And depending on where you fall on that scale, you may be eligible for certain programs or certain subsidies to help you find and afford health insurance. Once you file the application and they put you on that scale, the marketplace is going to determine what you're eligible for, right? Based on your income, you may be eligible for Medicaid, which is free, and I'll talk about a little more about that. You may be eligible for, if you're in a state that offers something called the Basic Health Plan. In New York, there's a program called the Essential Plan. It's a very low-cost plan. You may be eligible for that, or you may be eligible for what's called a Qualified Health Plan. Qualified health plans are the ones named after metals: bronze, silver, gold, platinum. If you're eligible for a Qualified Health Plan, you may get a discount based on your income. You may not get a discount based on your income, and you'd be paying full price. The time to do that is right now, right? So this is the time of year when anybody can go into the system and purchase insurance. You don't need a special reason or anything. You can just go in and buy an insurance policy or change your insurance policy. It's called open enrollment. Open enrollment in New York, New Jersey, and California started a few days ago, November 1st. It will run through January 31st. You would need to sign up. If you wanted January 1st coverage, you need to sign up by December 15th. If you wait till, if you sign up after December 15th, your coverage will start on February 1st. For states that use healthcare.gov, healthcare.gov, remember, is the federal website. The open enrollment period is a little shorter, November 1 to January 15. If you're outside of this time window, then you need a reason to go into the health insurance system, right? You need what's called a qualifying event, sometimes called a qualifying life event. What are these? These are things that that happen in your life that cause you to need to look for, find, and buy insurance, right? If you lost coverage, you lost your union, your employer coverage, you aged out of your parents' coverage at age 26, you came home from college and you lost your school coverage, that would open up a special enrollment period. And so would these other sort of life events, right? Getting married, getting divorced, having a baby, adopting a baby, a change in immigration status, etc. Once one of these things happens, you have 60 days from the event to enroll in health insurance coverage. Other exceptions when you can go in and get a policy. You can apply for insurance anytime during the year if by income you're eligible for Medicaid, or if by income you're eligible for the essential plan or the basic health plan. If you're putting a child on the child health insurance program, or if you're buying insurance for a small business. In a number of states, including New Jersey, currently, there is a low income special enrollment period. So in New Jersey, you see the note on the bottom here, 200% of the federal poverty level is actually above the Medicaid threshold. But New Jersey allows people with incomes below 200% of the federal poverty level to enter the system anytime during the year, right now. That's going away as part of the federal changes that happened in July. Those low income special insurance periods, SEPs, will no longer be available. If you need help applying and enrolling, you can always come to us. You can sign up you have to get an account now on our portal. You sign up with a username and password. You can request an appointment with one of our health insurance counselors. This is a very busy time of year, so it's going to take a little while for you to get a return call and maybe an appointment. But we are here and available to help, and we are here all year long. You can also go through the marketplace. So New York State of Health, there's a number that you can call, and New Jersey has a number. Healthcare.gov, there's not a number, but you can fill out the application on the website. And most state exchanges have navigators or assisters available to assist. If you're going to do this on your own, just make sure you have everything ready to go when you open the application. You're going to need all your personal information, immigration information, accurate estimate of your income. You're going to want to look at your 2026 income, and I'll talk about estimating income in a second. But you're going to want to have all the information together because you want to complete the application, in one go if you can. So income, always a big deal for freelancers or people who work in sporadic employment like those in the arts. Right now, like I said, we're estimating 2024, we're looking at 2025 income, most of which has happened already. After November 15th, you're going to be estimating 2026. There's a couple of ways to do this. In New York, number one is really a New York-centric provision. I mean, some other states may do something similar, but in New York, you can sometimes use your adjusted gross income from your most recent tax return. So the most recent tax return right now would be 2024, right? The one you filed this past April, as a guideline for eligibility. If your income in 2026 is going to be close enough, 10, 15, 20% away from where you were in 2024, you can sometimes use that estimated income screen on the application. You can enter an estimated income and get an eligibility. There's no penalty for doing that. And we use this strategy quite a bit, depending on the way people's incomes are bouncing around. If you're not going to do it that way, you're going to do it what I call the normal way, right? And you're going to build out your income on the application. When you do this, you're going to put in income, guaranteed income, income is coming, which I know is bizarre when we look forward toward 2026, because a lot of people in the arts, if you say, how much money are you going to make in 2026? The answer is, I have no idea what I'm going to make in 2026. But you're going to want to base it on your past experience. If you're collecting residuals, you may have a sort of, idea of what you might expect in residuals for the next year. You may have a contract coming, or you may know you teach on a regular basis. Whatever you can do to predict that as accurately as you can is what you want to do. So W-2 income, net 1099 income, any other sources of income, right? Interest, unemployment, if you're collecting unemployment and it's an ongoing claim, if you have rental income from another property, things, capital gains you expect, things like that you want to put in here. Gifts under $18,000, you do not need to declare on this application. You can also sometimes use deductions here too. So if you make a contribution, for instance, to a traditional IRA account, you may be able to deduct that from your income. Deductions like you would on a tax return to lower your income to get to a better eligibility threshold. Let me talk about a couple of the programs, right? Once you file the application and put in your income, like I said, the marketplace will determine what you're eligible for. If you're eligible for Medicaid, Medicaid gets a bad rap, right? But it's comprehensive health insurance at no cost, right? There are no premiums, no deductibles, sometimes very small $1 to $3 copays for prescriptions, but it's effectively free coverage. Medicaid runs for 12 months. If you're determined eligible and your income increases, it says you may be able to stay on Medicaid. In New York, you can stay on Medicaid. They're not throwing you off Medicaid. So you can remain on Medicaid for the 12 months. If you get other coverage, your Medicaid may change a little bit, but you can stay on it. In many states, including New York, New Jersey, and California, you can apply directly through the Marketplace website. And if you're eligible, they will. In New Jersey, they send you over to a different agency called New Jersey Family Care. In New York, they determine your eligibility immediately. And in California, I think they send you over to Medi-Cal, and you go and enroll through Medi-Cal. Medicaid, accepted at all hospitals, most urgent cares, covers all prescription drugs. The challenge with Medicaid, although it's the challenge across the whole marketplace, right, is that you have to find doctors who accept Medicaid in order to get the services covered. And the network of doctors that accepts Medicaid is much, much smaller than accept things like employer coverage or Medicare, right? So that's the challenge. But again, it's the challenge across the whole marketplace. All these plans are in-network only plans. Two ways to be eligible for Medicaid, annual eligibility. So right now, 2025, these are 2025 numbers. They haven't released the new FPL numbers and won't, I don't think, until the spring. Your annual income is under $21,597 for an individual, or $29,187 for a couple, you would be eligible. Or you can use a monthly eligibility, right? If your gross income in the current month was below the income limit, which is $1,800 for an individual, $2,433 for a couple, you can be eligible for Medicaid regardless of your income the rest of the year. So if you get eligibility for Medicaid via the monthly income test, you can remain on Medicaid for the rest of the year. The method you use is going to depend state by state, right? That's really pretty much the New York, New Jersey, California version, but it may vary in various states. This is something for New York residents, right? New York has a layer of coverage above the Medicaid threshold. If you're above the Medicaid threshold up to 250% of the federal poverty level, you will be eligible for something called the Essential Plan. The Essential Plan used to have a premium in New York. It no longer has a premium. The legislature has dumped a whole bunch of time and money into Essential Plan. It's comprehensive health insurance. It's medical, dental, vision, and prescription coverage. There's no premium, $0 premium, $0 deductible. The difference between Essential Plan and Medicaid, a couple of differences, but one big one is you're going to have copays at the doctor's office with Essential Plan. So you may owe $20, $25 at the doctor's office. I'm going to say something about that fifth bullet point. 2 years ago, New York expanded the income eligibility for Essential Plan. Currently, right now, this is the limit, $39,125 for an individual, $52,875 for a couple. Because of the federal changes that happened in July, New York is losing about $7.5 billion in funding from the federal government. They're going to contract that number down. That's not going to be the eligibility after mid-year 2026. So anybody who's on that expanded version of the essential plan up in that 200 to 250% FPL range is going to lose their coverage June the 30th. And they'll have to get a new plan in July. Nobody after July 1st will be eligible at these rates. It'll be a lower eligibility. I think it's about 31,000, 32,000 for an individual. I don't know what it is for a couple. I have to look at them. I think I have it short. Yeah. Second, in case people are interested in this. Sorry. $42,300 right now for a couple to get on essential plan. Essential plan for people 19 to 64, so you can't be a child on Child Health Plus, you can't be on Medicare. 12 months of coverage. If your income increases, right now they're giving you 12 months of continuous coverage. So if your income increases, you don't really have to go in and declare it, and there's no tax consequence to it. You can remain on essential plan for the full 12 months. Or if you get in there right now on these income limits for 6 months. Minnesota and Oregon offer plans like this as well, but the income threshold goes to 200% FPL. If you're not eligible for one of those plans, you're going to be eligible for what's called a qualified health plan. Qualified health plan, the ones named after metals, bronze, silver, gold, platinum. The cost for these vary by your household size, the company you choose, the county you live in, and depending on your income, you may be eligible, as we've been saying, for a discount, right? How does the discount work? When you go to the application, you're going to declare your income. And based on the income you declare, you may get a discount off your monthly premium. You have to think of the discount. Here's the thing about the discount. The discount acts as a tax credit. So there may be a tax consequence to the discount. You have to think of the discount the way the government thinks of the discount. If you tell the government, I'm going to make $40,000, they may give you $200 off the cost of your plan every month, right? Next year, when you file your taxes, if you actually made $40,000, the government is very, very happy because they gave you an appropriate amount of discount based on the income you told them you were going to make. But if you tell them you're going to make $40,000, or you estimate you're going to make $40,000, and then next year when you do your taxes or you file your taxes, you made $240,000, the government gets very, very upset because they say, listen, you told us you were going to make $40,000. We gave you all this money to help you pay your health plan premiums. Now you came back and you told us you made $240,000. You owe some of that money back to us, right? So the tax credit has to be reconciled on your next tax return. If you make more money during the year than you estimated, you're going to owe money at tax time. And these penalties or these tax, the amount you owe back, there used to be a limit on what they would collect from you. Now they've released that law in July released that limit. So you're going to owe the full discount back if you make more money. It works the other way, right? If you make less, you're going to get more of a tax credit on your tax return. But often it works in this way. So what's the takeaway? The takeaway: estimate as accurately as possible. You can always update your income in your marketplace account through the year, or in some states, especially New York, you can change the amount of discount you're taking to sort of mitigate your tax risk. If you want to do an estimate of your of what your discount might be, this is, sorry, I know this is a little hard to see. This is a marketplace calculator that's available on the Kaiser Family Foundation website, kff.org. You put in your state. I put in New Jersey on this one. You put in your zip code. You put in the amount of money you anticipate you're going to make. Excuse me, the number of people in your family, et cetera. And when you put in these data points, it'll show you what you may be eligible for. So in this case, for an individual making $40,000, who's 21 years old in New Jersey, Passaic County, New Jersey, they're going to get $237 off the cost of their premium. And their cost for a silver plan, right, which is a medium level plan, will be in the area of $154. The cost for a silver plan, they're showing you the second lowest silver plan in the area. So some of them are going to be more than that. In New York, there's a calculator like this as well. In New York, you see the prices are higher and the cost of living is higher. So for an individual, they don't ask the age of the individual here either, because we're community rated, I think. For an individual at $40,000, they're going to get $727 off the cost of the plan they choose. The different levels of coverage, just quickly, don't get roped into thinking like the bronze plans are the worst and the platinum plans are the best. That's not quite the way it works. What it really describes is the cost sharing for you, right? So bronze and silver plans are cheaper per month, but they're higher cost when you're getting coverage. So they have higher deductibles, higher coinsurance, things like that. As you move up the metal levels, which is from right to left on this page, you're paying a lot more in monthly costs, but your deductible is going to be zero, and your cost sharing is going to be very low if you're getting care. So that's really the way it works. So when you're choosing an insurance company, the things to focus on, it's not enough to choose a company based on their brand name, right? Blue Cross, Blue Shield isn't, that isn't always the best choice for people. What you want to focus on is how you're using the healthcare system, right? Are you generally healthy? You see a doctor once or twice, or are you managing more serious stuff, right? Do you have doctors you need to keep because you want to check if they what companies they accept, right? So which companies are your doctors in network with, and what can you afford, right? I mean, I think as prices go up, people are going to be more likely to sign up for bronze plans, which are cheaper per month and offer you a couple of visits a year, but they're going to have more costs on the back end if they get sick. If you're in a moderate income level, I would look at silver plans. Silver plans are sometimes designed to give you a little more bang for your buck. They come with deductibles, but often they'll give you a bunch of services for just a copay. So if you're seeing a doctor or a specialist, you may only have a copay for your visit. If you're uninsured still after all of this, right? A couple of things to pay attention to. We're anticipating that some people may decide to go uninsured if the costs get too high. Across the country, there's a website called Essential Hospitals that lists public hospitals all around the country. You can click on when you get to the website, there's a thing that says members. If you click there, you can see I think there's a map. You can click on your state. There's also a list of free and low cost and sliding scale medical, dental, and mental health clinics available on a website called Needy Meds. Needy Meds is mostly focused on prescription drug medication and discounted prescription drug meds, but they do publish this list of medical clinics that's quite comprehensive. This works for people, even, if you're on the marketplace in New York and you have in-network only coverage, which essentially means in-state coverage, and you're going on tour, this is a good tool to use if you need routine care. In New York, we have a couple of other resources, NYC Care and New York Health and Hospitals. NYC Care dedicated a lot to immigrant populations, but anyone can go in there and sign up for coverage. These are more like Medicaid type coverages. Discounts on prescription drugs. I mean, this has become a bit in the crosshairs as well. Needy Meds, I mentioned. There's other ones. A lot of people know GoodRx and Single Care. These will show you your drug prices at pharmacies in your area if you plug in your drug price. Another site that I like that is pretty disruptive, actually, is a place called Cost Plus Drugs. Cost Plus Drugs was started by a guy named Mark Cuban, who was he's a television personality on a show called Shark Tank. But it's a pretty interesting site. They have about 3,500 to 4,000 drugs on the site. You type in your medication. They don't deal with health insurance companies. So they buy directly from a manufacturer. They add a small markup to the drug, hence the name Cost Plus, right? And then they sell direct to consumers. it's always wise to check, I think, for what they do. You do need a prescription for the drug. You need a doctor's prescription, but you don't need to have insurance. And then I mentioned the medical clinics around the country by needy meds. Here's a screenshot from the single care. So this is a drug called Lexapro. And the generic is called, I can't pronounce that, but there's a generic version of it, and it shows the different pharmacies and the different costs. If you're using the single care coupon or whatever they give you. Here's the same drug on Cost Plus, right? So you can see that you can just order the prescription, you upload your order the drug, you upload your prescription, and get it directly. In New York, if you're in New York, if you're passing through New York, or you live in New York, we have a primary care facility in Midtown Manhattan, in the Actors Fund, the same building that the Entertainment Community Fund offices are in, 729 7th Avenue at 49th Street. It's a Mount Sinai clinic. We won a Tony Award, or we were an honoree at the Tony Awards in 2024. We have 4 primary care doctors. We have a sports medicine doctor starting on November 11th. We also have a podiatrist, and we refer out to ENT and orthopedic doctors that we affiliate with. We are adding another female primary care in January, and we're adding an OBGYN, a dedicated OBGYN in the spring of 2026. We accept all the union health plans, most employer plans, Medicare, workers' comp. We do accept marketplace coverages as well. So if you're on the essential plan in New York and you have a company called Health First, we accept that coverage. Oscar, Blue Cross Blue Shield, Health First, and Emblem are the marketplace plans we accept in New York. And if you have equity coverage from the Equity League, which is Actors Equity, or Local One, IATSE Local One, and soon IATSE National Benefit Fund, there's going to be no copay visits at the Friedman. So your visits at the Friedman will be free. If you're uninsured or underinsured and you work in the industry, we do offer a subsidy. We offer subsidized visits at the Freeman. So if you're eligible, you can get up to 3 subsidized office visits or telehealth visits at $40 each. You see the industry eligibility criteria there. You can contact us and somebody can test your eligibility for the subsidy. We also got a very generous donation from Tova Felcha, who's an actress here in New York. She gave a bunch of money for women who are uninsured to get gynecological and cancer screenings for ovarian and other reproductive cancers. So if you're uninsured and you're in the industry, you can get free OBGYN care here at the Friedman Clinic. So that's the end of the presentation. Let me stop the share if I can. And I'm also going to stop the recording if I can. Hold on a second. See if I can do that. Can I do that? Let's pause. Let's stop the recording. Okay.